Surprise court showdown centered on Obamacare. More than 150 million Americans use preventative services under the Affordable Care Act for everything from colon cancer screenings to cholesterol medication to HIV prevention. But a case before the Supreme Court today might change that. The justices are hearing arguments from employers who are challenging some of these preventative care obligations on religious grounds. So joining us now is one of the architects of Obamacare, Dr. Zeke Emanuel. He served in the Obama administration as a health policy advisor. Dr. Emanuel, thank you so much for your time. We appreciate it.
Good to be here.
First, if you could just kind of break down for us, it's been a while since I think a lot of the American people have been paying attention to sort of like the legal ramifications of the Affordable Care Act. And here it is, the Supreme Court taking a look at another piece of this. If you can just kind of break down what this would mean if the Supreme Court makes some changes.
Well, in the Affordable Care Act, we said that people could get their preventative services if they're approved by this United States Preventative Services Task Force as very proven to actually make people healthy. They could get it with no copay and no deductible. So people wouldn't have to pay anything. It would be fully covered by insurance. And we know that preventative tests in particular, cancer tests, preventative screenings for other diseases like hypertension, people tend not to use them if there's a copay because the benefit is long in the future and the cost is today. So getting rid of that copay, we thought would increase the number of people who got tests, and that in fact happened right after the Affordable Care Act was passed. This group of conservative Christians comes along and says, listen, we don't want to pay for tests to prevent HIV among people, a test that's 99% effective, and depending upon the cost of the drugs, it can be cost savings, actually reduce the amount of healthcare costs, because we don't religiously believe in homosexuality. And the court is now considering how do you balance the religious right of employers to their view versus coverage of the health insurance preventative services with no copay. I should say, we've got a system where employers are expected to, mandated to cover their employees' health insurance, and then to say, well, the employer can decide which benefits they want to cover and not, does seem, to me at least, a little unjust.
So let me ask you a little bit more about the potential fallout here. If the court allows providers not to cover these kinds of treatments, what could be next on the chopping block? What could be the long-term impact?
Well, who knows what could be next? A lot of insurers would say, listen, we would still cover these preventative services, especially this HIV one, which, as I say, if you use generic drugs, can actually be cost savings, which is very unheard of, where we spend some money but actually make more back. But, you know, private companies before the Affordable Care Act didn't cover a lot of services, and not just preventative services, maternity care. 3/4 of the non-group market had no maternity benefits necessarily. And again, we mandated in the Affordable Care Act 10 different kinds of benefits that had to be covered. I mean, you could imagine someone saying, listen, someone smoked, they got lung cancer, I don't want to pay for the screening and that kind of stuff. You have all sorts of reasons people can say they don't want to cover things. And, you know, it's not like everyone who gets HIV or wants to prevent getting HIV is homosexual. You know, people who have heterosexual sex can get HIV if one of the partners happens to be infected. And so I think this is, I mean, for those of us who are in the healthcare space, not having a copay increases the number of people who are going to get the preventative service, and the country's going to be better because this external group giving advice to the HHS secretary has evaluated all the evidence and said this is an effective intervention, will save lives, and will be beneficial to people.
There's another interesting layer to all of this, because even though the Trump administration has opposed Obamacare in the past, they are taking its side in this particular case. How could decisions about what preventative care to cover look different in a Trump administration and an HHS headed by RFK Jr.?
Well, the reason they're interested is because they want to get control over the United States Preventive Services Task Force and maybe restrict or limit what they recommend. famously RFK Jr. doesn't like vaccines. He said that, well, he was okay with some of them while he needed to get confirmed, but now he's sort of backed away, and it's a really unclear. But one of the ways the ruling could go is give them legitimate authority over this group and to say, listen, we're not taking all of their recommendations. We don't have to accept them. We have the Secretary of HHS has the final word. And what he will do with that is anyone's guess. As you know, he has been a little unpredictable in what he's going to endorse and not endorse.
Well, we will stand by and see how all of this plays out. Dr. Zeke Emanuel, thank you so much for joining us. We appreciate it.
Thank you for having me. I hope that's all clear.
You got it.